Thank you very much. So I'm a child and adolescent psychiatrist, and I see patients starting around 6 or 7 years old, all the way to 30 or 40 years old. I see a lot of young children for behavioral issues. I treat them with medications and therapies, but actually the biggest chunk of the patients I see are college kids. Because college kids are still kids, and what happens in childhood still affects them quite a bit. But before I get to talking about children and how to speak with them, I just want to talk a little bit about what Dr. Gordon talked about mothers. It is really, really important that a mother is healthy, because there is no other figure in a child's life that is more important than a mother. And fathers are important, but mothers are crucial. So a mother's health is so important, because if a mother is not healthy, it affects a child more than any other relationship or any other person in their life. And after all, we do know that when you were born as a baby, your first attachment is to your mother. So please, as a woman, please take care of yourself, particularly if you're going to have children, because your health doesn't only impact you, it will impact your children. So I just do want to say that. So how do you talk to your children? So one thing I've learned from all the kids that I see is that, believe it or not, they really, really want to please their parents. Now, even if they may be disrespectful to you, or oppositional, or defiant, they really, at the end of the day, do want to please you. It's just that they're just not going to tell you, because sometimes it's a little bit of a power play, and they feel that if I tell my parents that, then they're going to control me and tell me what to do, so I'm not going to tell them. Now, I just said that the mother is the most crucial figure in a child's life, but overall, all the relationships in a child's life through adolescence and actually through college, parents do play the biggest role in kids' life. Many parents of teenagers will often say, I used to think I'm important, but now the friends are important. My teenagers are only interested in their friends. And yes, teenagers are very close to their friends, and their social relationships with their friends are incredibly important. But at the end of the day, the parents are still the most powerful figure in children's lives. So everything that you say and you do to them affects them tremendously. I have seen kids in which parents will randomly say to them, well, you're stupid. You know what, you're just stupid. And the pain that it causes these kids is tremendous. And I will see these kids 15 to 20 years after they were called stupid, and they still remember it like it's today. And if you could see the way their faces change in my office when they talk about simple things like you're stupid or you're not good enough, you would be heartbroken. So I do want to really, really emphasize that the things you say to your children and how you say to them, they will internalize. And the worst part is that sometimes they start to believe that they are stupid or they are not good enough. And then if they believe that everything they do in life will be under the context of, well, I'm stupid and I can't do this. And even if you have data that says, you're a straight A student, you're a Harvard student, you can't be stupid. But I am stupid. I got into Harvard by luck. Nobody goes to Harvard by luck. If you go to Harvard, you're a pretty hard-working kid who has some intelligence. But it's incredible how these early words become who they are and what they believe. So I do want to impress upon that. So we will all get mad at children. Children misbehave. It's what they do. But that's a part of growing up and learning what's right and what's wrong. And there's a way to tell them what you're doing is unhealthy or unsafe, and a way to tell them that this is wrong, this behavior is bad, but you are not bad. And it's really important, those words. We often hear parents say, you're bad, you're a bad kid, you did this. No. You don't say you're a bad kid, you say that behavior is bad. What you did was bad, but you are not bad. And even though at that time you may be angry with the child and just not want to deal with the child, at the end of the night, when you're putting your child to sleep, say, I love you. I'm really lucky that you're in my life. You're the most important thing. It's so important to internalize kids with feeling special. I had a few questions I want to answer. One of them was, my kid is disrespectful. Can you read that one for me? Okay. There are some interesting questions about my kid is disrespectful. What should I do? My kid doesn't listen to what I say. So I think one of the first simple things you can do is when you talk to children, they're physically smaller than you. I'm going to assume we're talking about small children. One of the things you want to do is be compassionate and empathic to where they are. So just even physically standing up and looking at them and pointing at them or looking down physically is already a power play that you don't want to be there. We tell them, one of the first things we teach trainees is to sit down with kids so you're at an even ground with them. And so you're already reducing that power play. And then you want to word things like, it really hurts my feelings when you're disrespectful. I love you, but when you yell at me and you don't listen, I'm very hurt inside. Imagine how you would hear that versus, it makes me so angry. You're such a bad kid. You're so disrespectful. What would the neighbors say? How do you think you would feel versus the first way versus the second way? If you approach it the first way, it hurts my feelings. I don't know what I've done, why you behave this way, but I would like to know because I want us to be able to get along. I want us to be happy together. And believe me, initially the kids may not respond and say, I don't know, or they may say, you're a bad parent. Don't respond right away and say, well, that hurts my feelings, but can we try it again? Can we talk about it later on? Don't give up on the kid. But once again, try it again, but tell them how it makes you feel. Rather than focusing on them being bad, talk about the feeling. And of course, it's easier said than done. It comes with a lot of practice. But talking about feelings and behaviors and how they affect you is a way to really figure out what is going on with the kid. Sometimes kids are irritable and cranky, and it could be something simple as something happened in school, and they just don't want to tell you, because once again, they want to tell you, they want to please you. They don't want to necessarily tell you, I didn't do well in school, or I'm being bullied in school. They just don't want to tell you. And so what they do is they take out their anger towards you, because ultimately, you are, quote unquote, the safest people in their lives. So no matter how they behave, you are not going to abandon them. So if they're going to misbehave, they're going to do it in your presence, because it's the safest place. It may not make your life easy, but at least you're not going to leave them. If they misbehave in school or misbehave with their friends, they're out of their lives, but not at home. So sometimes their behaviors are really not about you, it's about something else. And oftentimes when I see kids, parents are shocked about what is going on and what the issues are. So that's really important to think of it that way. One of the other things that I get asked a lot about since I've been here, and it's also something that's been in the States for a long time, is eating disorders. Anorexia in particular is a very difficult disorder. It's a very painful disorder for the person who is actually suffering. And it's painful from a perspective, people who suffer from anorexia actually are suffering quite a bit. And for the people who are observing from the outside, it's very easy to be angry at someone who's starving themselves to death, particularly when they come from a place where there's lots of resources and food, and you see them wasting away, and they look awful. And it's really easy to say, just eat, just eat. It's so simple. Put food in your mouth. You look awful. And you can't do that, because you have to remember the person who's not eating feels enormous amounts of pain inside. And finding out what is causing that or what's driving that, requires a lot of work and a lot of patience. And in the United States, what we do, it's a really complicated type of therapy. One of the therapies is really one-on-one work with the therapist, because it's the therapist that really works with the patient to figure out what is the psychological meaning of starving oneself. Where does it come from? And although we say there's an increase when you see affluent populations who have this Western sense of ideal, an ideal woman is slim, I mean, that affects it, but ultimately there's some suffering and pain going on. And to understand where that comes from takes time. Second, I'm getting a dietitian to talk to them about nutrition, but one of the most crucial parts of therapy is family therapy. Because when you have a family member who's starving themselves to death, it affects the entire family. And it really provokes a lot of feeling in the family. It's very hard to watch a member of your family starving to death. And so, family work is a big, big part of it. And learning how to be supportive when you see a family member who just won't eat and is really, really becoming more and more emaciated and looking more and more unhealthy. So, it's hard to get into any other details, but it's really important that you have empathy for the person who is suffering from the eating disorders, because they're not doing it to punish you. It's really a lot of pain in the inside. And as Dr. Falva had said earlier, there's a high association with depression. Now, depression does not cause anorexia, but many, many anorexics have depression, and they suffer from depression for many, many years because there is the psychological pain that is causing and driving this is quite extensive. And it's pretty different than bulimia, which is a different eating disorder, and the treatment is very different. But those are two big illnesses that require a lot of work. The other issue with eating disorders is that they can go on for months and years before anyone recognizes that the illness has been going on. And so you have psychological pain that has been going untreated and unnoticed for a long, long time, and particularly bulimics. Bulimics are not usually super slim. They're normal weight and sometimes slightly overweight. So I have known patients who tell me, well, I've been a bulimic since I was 10 years old, and I'm seeing them at age 20. And so they've had periods where they're binging and purging, and it calms down. They may have stress in their life, and they binge and purge again, and it calms down. And nobody really notices because they run into the bathroom, and they take care of the purging quietly. And sometimes you see them eating normally, and they'll sometimes stuff their mouth when no one's present. So, these illnesses can go on for many, many years in silence and in private without people knowing. And we all know anorexics who walk around with 3 or 4 layers of clothes on all the time. And it's not until they get to extreme weight loss, where their hair is falling out or they faint, that they are usually getting medical attention. Then that's when people start to recognize it. So those are the big things, the big issues around eating disorders. And the other one that I've got a lot of questions around is ADHD. I have a very interesting question that somebody wrote, that they have a daughter who's 8 years old and was treated for ADHD, and she's actually worse. So one of the things we learn in child psychiatry in particular, if you're treating someone, particularly with medication, and they are worse, number one, you've got the wrong diagnosis. So maybe this little girl probably does not have ADHD. And number two, with children and medications. Now, I treat children with medications, and I can find that sometimes medications can be very effective. But the one thing about medications with kids is that, and this is a discussion I have with parents for a long time before I start them on medications, of the risk and benefits of medications. And the reality is that we don't have long-term studies about the effects of medications on the developing brain. So the question is the medication the right medicine, but is it too much medication? Is it being given appropriately? But the biggest issue is, are we missing something else? And to think about, did we miss the diagnosis? Because once again, children don't necessarily have the same symptoms as adults for the same diagnosis. And bipolar disorder often looks like ADHD in children, hyperactivity. Kids sometimes just don't sleep well, they talk fast, and to really distinguish, is this a mood disorder versus an ADHD disorder, is very important. and also simple depression in kids often presents as headaches and stomach aches and weight loss, and what you have is clinical depression. So once again, kids are, for lack of a better word, a different animal than adults are. So it really takes a lot of time to really understand what's going on with children. So it's really important that you take the time to figure out what is going on. And if you're not sure, get a second opinion or a third opinion or a fourth opinion. But keep working, and don't give up with kids. Being a kid we think is easy. When I remember growing up, my parents would say, "Your life is so easy. All you have to do is study and play. There is no stress in your life." And that's not true. Kids feel a lot of the stress. And when I was growing up, my mother was hospitalized quite a bit for cardiac reasons, and my parents thought that I didn't know anything because they never told me. But I was always very aware when she was sick. But I felt that I wasn't allowed to talk to my parents about it because they didn't tell me. So I wasn't allowed to talk to them. So I would often be at night worrying, is she okay? Is she going to be okay? What if something happens to her? What's going to happen to me? Who's going to raise me? And it affected me in school sometimes because I was exhausted because I was not sleeping at night worrying about my mother. And if my parents had just sat and talked with us, it would have calmed me down quite a bit. So once again, talking to your children, not only when they're sick, but even before they become sick, is really important. And your kids will teach you when you say the right thing and when you say the wrong thing. Because when you say the wrong thing, they're going to leave. But when you say the right thing, or you're starting to say the right thing, you will have a communication with your children that will make all the difference in the world in their lives and your lives. And I'm told to be quiet.